Okay, I'm going to go ahead and share a few slides that we will look at together, and then we will get started. Okay, again, welcome to our Blue Sky group virtually on adolescent sexual health. And we have offered a couple of Blue Sky groups now in this virtual setting, and certainly happy to get feedback from this group in addition to just how this session goes, but also any feedback on doing these via Zoom, as I think we will continue to be in this format for the next year. We welcome each of you. I understand this is Adolescent Sexual Health Week at CHOA, and so we're really excited that the timing coincided with this week that's focused on this important issue as well. Again, I am Associate Vice Chair in the Department of Medicine for Research and Faculty Development, and have hosted or facilitated Blue Sky groups previously. I am actually a geriatrician by background, so at the other end of the age spectrum, although I do have adolescents of my own, and that's okay, because the way that these Blue Sky groups work is it really is an opportunity to bring together people from different perspectives, and even me as a facilitator, to really help guide just discussions. They are unstructured on purpose to really promote brainstorming, new collaborations around a common research theme. And so we're so excited that each of you are here today. The idea is to cultivate ideas, make productive connections between collaborators, investigators, educators, clinicians, policymakers, and really the outputs from these Blue Sky groups are, have gone in a lot of different ways. So sometimes a new grant comes out of a Blue Sky group. Sometimes a new course offering does. For instance, the School of Medicine at Emory's Health Services Research course was an output from a Blue Sky group, grew out of that. Sometimes it's new papers, sometimes it's new clinical programs. So that's okay, and all ideas are welcome. And then again, we coordinate these usually at least once through the CTSA. And then future meetings are really about kind of what develops from today's discussion. And so Lauren will be available to help us with organizing potential additional meetings among, depending on, again, where the discussions go. And so I see Lauren and Holly and Andres now on camera. So thanks so much for all you're doing. So now one other housekeeping thing just for kind of how today will run. So we'll spend just a few minutes here introducing broad topic areas that also coincide with some of the breakout rooms. And then we'll spend 45 minutes in the breakout rooms. If you did not complete a survey that was sent to you by Lauren already about your preference for one of the breakout rooms, please do that as a private message now. And then Lauren will have that kind of set up to quickly get you into the right breakout room. And then we'll all come back together to this main meeting space virtually for 30 minutes at the end to do a report out. And each of us that are facilitating the breakouts will be keeping a Google Doc of comments and ideas. We'll come back at the last 30 minutes to report out and have any further discussion. Okay, and there'll be an opportunity to kind of introduce yourself and your focus area as part of the breakout rooms. Okay, and now I will turn it over to, I think Holly is next.
Thank you so much, Camille. Is my audio okay?
And I can advance as needed.
Yes, perfect. That was going to be my question. Thank you. All right, so welcome everyone. We are so excited to meet all of you today and to hear your ideas and form new collaborations. As Dr. Vaughn mentioned, it is Adolescent Health Week at Children's Healthcare of Atlanta, which is where I practice. So I wanted to tell you a little bit about our practice. I will be facilitating the group that is on contraceptive services specifically, but also thinking about adolescent health services generally and where we deliver them. And so I wanted to give you a little bit of sense of where I'm coming from and look forward to hearing from all of you as well. So in our adolescent medicine practice, which is located on the Hughes Spalding campus, you can see that we offer many confidential services and treatment. I won't go over all of those. You can find that on our website, but I wanted to stress the issue of confidential. That's something that Dr. Vaughn will be talking about in her group. How do we ensure confidential services and access to those services, thinking about communication and policy as well. And you may go to the next slide, please, Dr. Vaughn. So in our practice, we are fortunate to have 4 board-certified adolescent medicine physicians in the Children's Healthcare of Atlanta system. We have Dr. Laura Obajuru and Dr. Yolanda Wimberly from the Morehouse School of Medicine, and myself and Dr. Swirlick from the Emory School of Medicine. And we together provide services at CHOA, but also in other venues, including student health services for many of the local colleges, including right here at Emory. We have a program coordinator who I know has joined us today for our practice at Hugh Spalding, Ebony Johnson, and then we have a variety of services that we offer our patients, which again is something we can talk about in some of the breakouts. How do we provide multidisciplinary care across many domains for adolescents? Next slide, please, Dr. Vaughn. So again, I mentioned we're going to focus on a couple of the breakout groups around the issue of confidentiality. So I thought it would be important for those of you who may be less familiar to go over a few of the things around confidential services for teens, just so we're all working from the same background information when we get into our groups. So it really varies by state when people are considered a legal adult. In most states, as is here in Georgia, that is at age 18, although it's not true for all states. There are some exceptions that most states, including Georgia, recognize as being an emancipated minor, meaning able to make legal decisions for oneself and one's healthcare. And those include being married, serving active duty in the military, living completely independently from one's family, meaning not just physically, but financially. And then in the case of parenting, if an adolescent is parenting, they are the legal decision maker for their own child. We also have mature minor situations, which is what we will be talking mostly about today, which is specific situations where adolescents can access confidential care, such as sexually transmitted infection screening and contraception. And there are policies from major medical groups, including the American Medical Association, the American Academy of Pediatrics, and our own Society for Adolescent Health and Medicine that go over these in more detail. Next slide, please. And finally, here in Georgia, minors may consent to contraceptive services, STI services, which is specifically testing and treatment. Prevention is a little bit of a challenge, as I'm sure Dr. Camacho may talk about, whether that's considered a confidential service. Prenatal care, again, for themselves, adoption, and then also medical care for their own child. And we are a parental notification state for abortion. I think that might be my last slide, Dr. Vaughn. Yes, I'll turn it over to Dr. Camacho.
Thank you, Dr. Gooding, and welcome everybody. I just wanted to give you sort of a group of HIV in adolescents and sort of potential prevention efforts, which will sort of be a background for what we will be discussing in our breakout room. So just for those in the audience that may not know, HIV in the South in general is pretty, the incidence is pretty high compared to the rest of the country, as you can see there in the map. And although there's been some improvements in the decreasing the incidence of infections in youth, there's still significant disparities compared to other groups, especially between, 13 to 24 years of age, as well as is it localized mostly in the gay and bisexual man population, although other groups, as you can see there, are also affected. If you can take me to the next slide, would be great. Thank you. Then you see here sort of a distribution by age and by year. And although you can see most of the infections we're seeing in 20 to 24, there's still a significant number and most importantly, a stable number in the ages 15 to 19. And this needs to be seen under an important caveat, is that a lot of the testing services are not as great for people under 18. And this may be a misrepresentation of the actual numbers. Next slide. Then if you look at by state, you can see Georgia is not in a great position. And so it's important for us to understand this so we can actually focus much better on the prevention strategies to get those numbers down. Next slide. So, you know, in HIV, there's a combination of different types of prevention interventions. And, you know, the one that we'll probably be discussing today is PrEP, but that's not the only thing that we potentially have. But today we'll be focusing in PrEP. Next. And in terms of PrEP, this is sort of this, as people may know, in 2018, the guidelines for PrEP were approved for inclusion of adolescents in the PrEP guidelines, and that was based on, this is one of the studies that you see there in this slide. One of the studies, and you can see, I didn't want to present the study in itself, but I wanted to sort of make a point. If you look at the light bar or above 700, that's the amount of medication you will need to prevent HIV. And you can see by 12 weeks, only about 50% of adolescents were reaching that, but you can see how if it progressed all the way to 48 weeks, how that bar decreases with time. So I think part of the discussion is not only how we get adolescents to PrEP, but how we keep them in PrEP and prevention services, which is also really important. Next slide. And then again, we're not meeting the quota, right? Of all the PrEP prescriptions that are in the United States, adolescents only are about 1.5%. So there's a lot of room for improvement in increasing sort of our coverage of adolescents at risk. Next slide. And then, you know, Dr. Gooding and her team has come up with a PrEP program that is offered at TU Spalding. And so part of this is also sort of letting you all know that there's a potential possibility, or there's a possibility for adolescents to be seen in our clinics. And we have an entire system. And unfortunately, you know, we've been live for some months now, but we only have about 2 referrals. So the idea is, how can we get more people into the PrEP program, and that is now available. Next slide. And I think that's my last slide. Correct. Yeah.
Thanks so much. And I think there was a delay between when I pushed advance and when it came up. So I appreciate all your patience with those connection issues. Okay, so I think we will head now into the breakout rooms, and we'll wait just a minute or so once that transition occurs to make sure everybody lands in the room. And then within that, again, each of us facilitating will also be keeping a Google Doc of the discussion items, and then we'll come back at around 1 o'clock for the overall group discussion. And Lauren will give us a warning kind of when that time's coming. And there'll be a time to kind of introduce ourselves to each other in the breakout rooms as well. So we'll split up now, I guess. Lauren, any other instructions for us?
Nope, you should be good to go. Thanks.